Health authorities in Uganda's Kigezi sub-region, in partnership with the United States Agency for International Development, USAID, have initiated a campaign to engage journalists in raising public awareness about Mpox disease. Since the outbreak in July 2024, Uganda has confirmed 11 cases with no deaths reported. The outbreak was first declared in the neighboring Democratic Republic of Congo. Dr. Gilbert Mateka, the Kavale District Health Officer, and Alfred Wesigensi, the Kavale District Health Educator, emphasized that engaging journalists will facilitate the swift dissemination of crucial information to the public to help prevent the spread of the disease. They highlight that districts in Kigezi are particularly at risk due to their frequent interactions with individuals from neighboring countries like the Democratic Republic of Congo, where Mpox is believed to have originated. Moreover, the media's involvement is vital for ensuring that public receives accurate and factual information.
People are worried about the points of entry. Like we are saying, we are here for prevention, to emphasize prevention, and we want to rally the community to be on our side. That's why we are creating this awareness. But as a health system, we have always had mechanisms in place to control importation of infections. So at all our gazetted borders, you mentioned the Bunagana, Chanika, here at Katuna, we have there, we call them points of entry or port health. We consistently screen different conditions on a daily basis. So that has not stopped. We shall continue to do that. In any case, we do what we reinforce to make sure that it's done even better with the monkeypox in the mind. So the borders, already we have teams there that do screening, as we've always done. And so we shouldn't worry so much, but we remain on risk, of course. That's why we are reinforcing this. On preparedness, you're asking whether the regional referral is ready to take care of the cases, whether we have PPE and other things. This, and again, that's whether we are continuing with this, so it's ending with the media. No, actually we started, we've been doing this. We've been on radio, some of you have hosted us. We've been in the communities, and this is one of the many activities that we are doing in that line. So we are continuing. This was your time, because we want to work with you. On Wednesday, we should have a district task force, the first meeting. And in that task force that we shall start, assigning different committees to make sure that everything is in place. So we are starting to, it is not starting per se, but it is like invoking. We have always had a plan, we now want to put it in place. So we shall have a meeting on Wednesday, the district task force, and then we shall assign rules, laws and duties to make sure that we are all alert. All we are doing is to improve our alertness in regard to this particular condition. So yes, the regional referral, as always, will improve its alertness and preparedness to respond in the case we have a case. Somebody said, do you have suspects in Kawale, please? No. We don't have a suspect where? In Kawale. That we shall repeat several times, so whoever will post it today, we shall know it was deliberate, not by mistake, okay? So we shall repeat it as often as we can. We have to create awareness, to put in prevention measures, but we don't have any suspect. In Kawale, I don't think even in the region, we don't have a suspect. So please, that one, no suspect. Yeah, I think anything unanswered. Tourists and schools. When we mention these prevention measures, what he's been doing here about how to protect yourself, what to do to prevent getting infected. When we teach about how it is, how it is spread, the message is to everyone. Who is the tourist? Who is the tourist? Who is the tourist? It's you. Tomorrow you can get on that vehicle and you're what? You're a tourist. If you become a tourist with information, then you're protected. So as we pass on this information, it is not for the wananchi, not even you, the media people. You need, sometimes we want to think that this is for those people, the message is for, it's for us.
Big preventive mechanisms, not to expose the children, the students who are at school. Once anyone develops signs and symptoms, they are able to identify those cases early. But we are sure that most of these children, those who pass through the border, we are screened because we have screening, the points where we are screening. Even Katuna border, when you go there now, we do screening. Isn't it so far?
Yes, sure.
Yes, so we really do that, and I'm very sure that we are not risking any person that is entering into this country also to bring the infection. Yes, Ryan. We want also to highlight how do we manage the borders. The border, the RDC here, we talked about it also, but we're saying we want people to get knowledge, information on how they can prevent themselves. Is it okay? But we know there are porous borders. People will pass through non-gazetted borders. Is it okay? So, but if you know how to prevent yourself, and this person comes to you, you know, but this person is coming from Congo, and we are saying we should not be closer to people who are coming from high-risk countries. And we did it during COVID. People would even report. Whenever a person would move from one country to the other, through the porous border, people would easily report so fast. And I want you to really know that it's very, very important. Then another colleague was looking at capacity of the health worker. This is a new infection. It is not very common. It was not very common. So, but we are building capacity of health workers. So, first of all, on suspecting and sending samples, and therefore detect, treat. If the cases are confirmed, we have a treatment center in the region, because the regional referral hospital will always manage cases once they are they are identified, and we have the capacity, because already this Mpox is not the first viral infection we have had in the country. We had Marburg, we had COVID, we had Ebola. All those are viral infections which are highly infectious, and the management mechanism is the same. So we know we have the capacity in the region, but of course we keep on building capacity with health workers to know. Already we have had a Zoom meeting with all our health workers. They can now identify the cases, and they have the basics on how they should really manage the disease. The protective equipment, we have them. We have enough. We're very grateful for the government. We have things to use for our health workers. Even the vaccine actually, but has not yet moved in all the places. But it's like the districts where we have had cases, they are planning vaccination. But we don't have the cases in Kabale.
Martin Niwataho, the Assistant Kabale District Resident Commissioner, has warned that anyone attempting to sabotage efforts to combat Mpox will face arrest and charges.
Outbreak in the country is a threat. Therefore, our concern is about people's lives. We are encouraging, for the first time, I think we have been having an engagement on the radio talk shows about this disease. But now, I thank the team that have gone ahead to address the media. Media are going to play a big role to fight against this outbreak. First of all, we are encouraging the public through the media, the public to become vigilant. For the first time, I think when we had the COVID, you know how we participated. It was through the media that we spread the gospel on how to prevent the outbreak of COVID. Therefore, we are using the same means through you media to spread the gospel within the community, to be vigilant about the disease and to know the reasons and how it is spread. Therefore, we are encouraging you, go outside, talk to the people, talk to the masses about the outbreak. Let it not be politicized, as you have said it in your briefing. Another thing we are saying, let us be compliant. If you find yourself with a disease, go to the nearest health center, report the case, let it be attended to by the people in charge of the health center. Thirdly, we are saying, we are seeking for cooperation. There is nothing that can happen when you don't cooperate. Therefore, the media and the officials within the district plus the community, let us cooperate, let us know where the suspects are, we report them to the nearest or to the officials in charge. As the security, we are here to assure you that we shall work with you hand in hand to see our population protected against the outbreak. Another thing we are talking about the awareness. This is I've liked the mode of communication now. As the government, this is the best. Before we approach the public, we have briefed the media. You know, media plays a big role. Yeah. They can report falsely or they report what is needed to hear. Therefore, media, the press release that we have done, please we are requesting kindly, take the right information to the right people. Then saboteurs, most of them are media people. You write anything because you are looking for favors from this politician. The government is working closely with you. Anyone to saboteur this thing, we shall arrest you.
Mpox or monkeypox is an infectious disease caused by the monkeypox virus, presenting symptoms such as a painful rash, enlarged lymph nodes, and fever. The virus spreads through contact with infected individuals via touch, kissing, or sexual contact. It can also be transmitted from animals during activities like hunting, skinning, or cooking, and through contaminated materials such as sheets, clothing, or needles. Pregnant individuals can pass the virus to their unborn babies. Symptoms of Mpox include a painful rash, enlarged lymph nodes, fever, headache, muscle aches, back pain, and low energy. Memory Aguma for iTelevision.